It's wonderful to see such a lovely mix of comms pros from the NHS and councils here today. My name's John Paul. I work for CAN, and we help councils and ICBs improve the efficacy of their campaigns. But why are we here today? Well, specifically, we're here today to launch a new community. It's for you, and it was inspired by multiple conversations that we've had with Council Public Health Comms Pros and ICB Comms Pros about really the relationships that they have with each other. And we've seen huge variance in this across the country. And where there's variance, there's an opportunity to come together and to share. We also know that there are going to be big changes at ICBs in the coming months, and that the landscape is constantly changing. So a community that comes together regularly to share ideas, ways of doing things, good practice, bad practice sometimes as well, just so that we can all see it, but really just accelerates the rate at which we borrow from each other, which is a superpower that the public sector has. So we wanted to make a space for that, and we couldn't think of anyone better to host this community than Russell Cartwright, who has been working in the NHS for over 20 years. He's a specialist in public health behaviour change, is about to start offering training for people working across the public sector in behaviour change and in running campaigns. So we're very excited to have Russell here with us today. Russell, would you like to tell us what today's session is going to be about?
Thanks, JP. Hi everybody, and thanks for joining. Really excited to get going with this this community really. And as JP said, it's very much about kind of sharing examples of good work, sharing learning, and trying to learn from each other and make the most of what we can do. So today we thought it would be helpful because I think. Relationships, in my experience, relationships between the NHS and ICBs and local authorities, particularly public health, is very variable. There's examples where it works really well, and others where it's not so good. I've come here today with my colleague Wendy from Royal Borough of Greenwich, where we're not perfect, but we have a very good working relationship, and we've worked really closely in the last 3.5 years or so, I would say. So we're going to share a little bit about our experience, and also hopefully hear from you about your experiences of working together. So yeah, if I could just ask Wendy to introduce yourself, please.
Thanks, Russell. Hi, everyone. I'm Wendy Elcome. I'm a senior manager within public health department within the Royal Borough of Greenwich, so within the local authority. My area of expertise is around tobacco treatment and tobacco control, but I've worked around that for like 28 years. Was in the NHS for many years until we then moved over 10 years ago now into the local authority. So as Russell says, worked in public health a long time, but have a very personal interest in communications and getting public health messaging out to the public, and particularly sort of targeted messaging as well to improve outcomes. But yeah, here today, looking forward to sharing how we've been working together. And as Russell said, there's no perfect 100% here, but we're sharing our experiences. So looking forward to hearing about yours as well, and some of your challenges, and how we can work together to get better outcomes for our residents and patients. So nice to meet you all.
Thanks, Wendy. I'm just going to put a few slides on the screen, which, Wendy, could you just give me a nod that you can see them? Yeah, brilliant. Okay. I'm not going to leave this slide on the screen for long. We are planning to share the slides with people. If you can get in contact with me via these means, or via CAN, should you wish to. So what's the recipe for successful collaboration between public health and NHS ICB comms? Here's what we think are some of the key ingredients, and some ideas that you might be able to put in practice in your areas. We want to share our experience of successful collaboration, like we said, in Greenwich Borough, as we think there's things other areas could learn from. None of this is rocket science, and like we said, we don't have all the answers, but what we have developed is a very positive culture of working together that's become second nature for Wendy and I, but also for many of the people that we work with in the surrounding teams and colleagues. And as with all the best recipes, certainly the way I cook anyway, this can be adapted based on the circumstances in your area. So, what ingredients are available, what's your budget, how much time do you have, how big is your appetite, that sort of thing. So it's not a set formula, but there might be some hints and tips that could be useful. So this sounds terrible, but Wendy and I were forced to work together during the COVID pandemic. And I'm sure that was the same for all, if not most of you, in other areas. I started working in
tonight. There's blues bands on the shelter.
Sorry, just somebody to go on mute. I moved started working in Greenwich during the summer of 2020, so quite early in the COVID crisis. And it was really vital that we worked together to share messaging. Things were changing constantly. We needed to work together, and we needed to bring in other partners who we hadn't worked that much with historically. So, Wendy and I learned a lot from that process, and we were determined that we didn't lose all that good work and all the learning and all the relationships that we developed. So, going forward, I think a key ingredient is having one named contact in each organisation. I'm really lucky that in Greenwich we have Wendy, who's very much my go-to person for anything public health related, and vice versa. Wendy comes to me for anything that is NHS related. But I think much more than that, we've shifted the mindset, so that one of the first things we think of is, or for me anyway, one of the first things I think of, and I'm sure Wendy thinks the same, is what would Wendy's perspective be on that? And that's become infectious. It's now become second nature for the council's corporate comms team to consult me and to work with me and my team. We have lots of meetings together and lots of things that we work on together. And on top of that, Wendy has really paved the way into lots of different places in the local authority for me. I've come and talked to the entire public health team about partnership work, and I've built relationships with a lot of them. So developing the relationships and building the trust is really, really important. In Greenwich, we've moved from a position where, when I started, we each had our own separate work streams and budgets for things like flu campaigns, and things weren't particularly measured. They weren't very joined up. And we went from that in a really fairly short space of time to me being trusted to be given access to the council's social channels to run a localised behaviour change campaign on COVID vaccinations for young adults. So, I went from very little trust to being trusted, by that work and by building those relationships and by demonstrating the value, I think. So I'm going to hand over to Wendy now.
Thanks, Russell. So just building on that, as Russell said, I'm within public health, which sits within the local authority, and as many of you sit in local authorities, there's lots of policies and procedures we have to follow, and we also have our own corporate comms team. And yes, Russell probably could go directly to them, and others of you here probably that are in ICB and NHS just go straight into the corporate comms team. But by linking in with myself, I'm kind of the gateway into like the local authority. I mean, we've got quite a big team in public health in Greenwich, fortunately, so it can be quite difficult for people to navigate who's leading on what. Who do I need to speak to about alcohol? Who do I need to speak to about tobacco, for example? So it's really handy both ways, that the corporate comms team that I link in with know within public health to come to me. They don't have to go to, individual people within public health, and it's very much coordinated. And Russell knows if he needs to tell us something about public health, he can just come straight into me. And then I can bring in the corporate comms colleagues from the local authority. So I'm kind of that gateway person. So again, I guess a take-home message here is if you're working in public health, then speaking to your DPHs about who might be the best person or having a lead name contact within that public health team would be really recommended. They might not have the luxury of having someone dedicated to communications, but they could just probably be able to say, for now, someone be that contact and that way in for you. So that would be a really good tip. As Russell says, we sometimes we felt that we were seeing each other more than our own families during the pandemic. We were meeting probably every other day, and like probably many of you, we were meeting so often about communications because public health and communications became an absolute priority for everybody, and we were very much firefighting and having to be reactive. And you probably all remember that, you know, guidance was changing on a daily basis, often on a Friday afternoon when you were trying to finish and something all changed, so you had to quickly mobilise. So we kind of wanted to carry on that, not that intensity, but that kind of building of that relationship. So for most of the projects and programs that we're working on, we have an overarching sort of strategy group or a board. But what seems to have happened because of our relationship is that we've had like subgroups of those big boards that are just focusing on communications. So on those subgroups then would be corporate comms from the local authority, Russell from the ICB and the NHS, myself from public health, and then also a range of other people. So we tend to have sort of, you know, subgroups. So that would be another recommendation where you can really focus in on the communications elements of any programs. With that as well, and all the sort of identifying those short and long-term shared goals is really valuable. If you go back to the pandemic, I think the reason why it worked so well is that we all had one goal that we had to achieve together, and that was really clear, and we didn't have any choice. But I think, you know, what we learned was if you can do it for COVID and during a pandemic, then you can do it for other public health outcomes and improve those outcomes by working together. So really looking and planning together as a group of people and sharing that problem solving, but also sharing potentially finances, but sharing the burden of work. So I think before, local authority and NHS is very, very separate, and, you know, maybe can be seen as like territorial, you know, that's our responsibility, that's your responsibility. But now working together over time, you know, we might be working on a project and think, right, that's the deadline. We've got loads of other deadlines in our design team, so maybe it'd be better for you this time to design this flyer because you've got a little bit more capacity. And it's kind of that shared ownership of the problem solving, people becoming less precious about things and sharing that work just to get the outcome. And as Russell said, I think over time that's just become really natural. You know, corporate comms might want to put something out, and in the past they would have just put that out, and now over time I think where I've influenced, like, let's check this, let's check this out. So we might actually get Russell's view on checking if there's any NHS angle to the story that we want to run or for the messaging that we want to run. So there's always some kind of extra bonus by actually bringing in other elements to whatever messaging we're doing. So yeah, I think that's sort of for that on that part. I think we're going over to have a bit of a poll now. Thank you.
Thanks, Wendy. Yeah, if you could have a look in chat, I think there's a separate thing to click on called polls, and do bear with us. It's the first time I've ever used these. So, but we're going to ask you to share some of your experience. We've got, like we said, we've got a really good mixture of people here from councils and public health and from the NHS and ICB. So there's 3 questions which we'll be loading as polls. And the first one asks you off the top of your head to quickly rate how well your NHS, ICB comms and public health work together from a score of 1 to 5. And then one asking you to name one thing that's been really challenging in terms of partnership working. And another one to name one thing that's worked really well in terms of partnership working and collaboration. So yeah, please do take a minute or two to quickly fill in those polls, and we will come back to the results of that a little bit later on. Thank you.
Seems to be working, Russell.
Brilliant. Thanks, JP. So back to Wendy.
Thanks, Russell. As Russell said, when we had the pandemic and you know, we were all kind of I didn't like that word, Russell, forced to work together, but we did, you know, we're obviously forced by the situation. So, but many of you would have had this. And so we had, we decided the best way to sort of cope with all the messaging and everything was to establish a COVID comms group, which, as I said, met twice weekly for ages and ages and ages. Then it went down to once a week and then once every 2 weeks. But certainly what we felt was that we were achieving great things by working together. And as I said, if we can work together on COVID, that, you know, in that effective way, then there would be no reason why we couldn't work together on all of the other public health topics and health topics that we needed to work on. So we kind of decided, and Russell and I pushing it through really, that we wanted to continue, and we set up and it kind of evolved from the COVID comms group to a health and wellbeing comms group. And not just the normal players are on that. I think we always think of the big organisations like the hospital trusts and NHS ICB and obviously like public health and local authority, but we also have the GP like federation on there. We have Health Watch. We work really, really closely in Greenwich with Charlton Athletic Community Trust and the football club, so they're present. The university were great partners during the pandemic. They shared our messages. We used their sites for testing and vaccinations, so they remained involved with us, and South East London colleges, for example, and Chamber of Commerce as well. So a real wide range of partners that are involved. So I think, again, another take home message is have a think about the obvious people maybe, but then think about other groups and partnerships, the voluntary sector, the CVS, the community groups, neighbourhood groups, anyone else that would be really beneficial being part of your local partnership that can continue to share those messages and amplify and maximise the impact. I think the group in itself is powerful, but then because of those relationships, what happens in between meetings is also then really helpful. So for example, during I had some really interesting information come to me around Freshers Week and mental health support for students. When that came in, I know the university contact really well now through our group, and I can just ping off an information to her, say this might be helpful, and then she can share it through her channel. So in between times where things come up, you've just got that real personal relationship with all these people. And vice versa, if they want to get something out, they might share that with us. So I think the meeting in itself is great to share stuff and tell people what's coming up and forward plan and work together. But in between times, you've just got that relationship with those people in those really big organisations where you can ask them to share things or put it in their newsletters or on their socials. And you can just carry on doing that in between time as well. So, yeah, I think it really highly recommending if you can get a partnership back up and running. So, or if you've not had one before, set one up if you can. Thanks, Russell.
Thanks, Wendy. Can I just check the slides are still on screen because something strange happened on my, yeah, brilliant, okay.
They are for me. They are for me.
Good, okay. Just here's some examples of some of our joint work over the past few years. So we've got a community champions program, as I'm sure lots of areas have. As is very much a joint initiative. We set it up in COVID. We took the decision to continue it because we can really see the value of it. Every week we agree key health, wellbeing and care messages, which we send to community champions and ask them to share with their networks. Public health manage an email bulletin, and at my side in the NHS we manage a WhatsApp group. And we did a survey of community champions, and there was an estimated reach of 30 to 80,000 people with the messaging, which is, you know, really amazing. We've done a lot of work jointly on things like cancer prevention. We had a lung screening project, communications about cervical screening, and Wendy and I are both working on an in-house behavioural science-led breast screening campaign at the moment, because rates are low for breast screening in Greenwich. On vaccinations, we've done a huge amount of work over the past few years. You know, we've planned mass vaccination events together where we managed to get more than 3,000 people vaccinated with 8 days from when the event was confirmed to communicate about it and promote it. We've also worked together on, you know, a number of campaigns. outreach, including things like boots on the ground activities, small grants for educational activities around childhood immunisations, and lots more. This now has become, we've moved from, I described earlier how we had kind of separate silos working on flu when I first moved to Greenwich, to now it's very much second nature, and we've got a regular comms group who look at just look at vaccinations. Wendy and I coordinate regular content in Greenwich Info, which is the council's fortnightly publication, and we have at least a page in every issue of that. We also work together on lots of things like stalls at big events, and work together to develop our neighbourhoods. So we're working kind of with residents to help make the areas they live in healthier and happier places to be. So yeah, that's just a bit of a snapshot. Wendy's going to show you some of the things we put in Greenwich Info now.
Thanks, Russell. As Russell said, we have an advertising space in the free publication that goes to every single household in Greenwich, so it's a really wide spread way of getting information out. So that's every 2 weeks. So there's just a few examples of some of the campaigns and adverts that we've had, so ranging from, as we've done a hell of a lot on vaccinations, as said, so quite a lot on directing people to the right service, introducing your pharmacist, for example, what support and services can you get from your pharmacy, MSK, HIV, sexual health. So again, we tend to theme it around what's going on in nationally as well, to make sure we're maximising on national campaigns or special days like World Mental Health Day or Sexual Health Week, for example. Russell mentioned the targeted lung health check programme. Greenwich and Southwark and South East London were both picked to be part of that pilot. So we did quite a lot of work around promoting people that were going to get invites to be part of that screening programme. And some just more here examples of Stoptober advertising, mental health, and a lot on vaccination. So these are just a sort of spattering of examples of ads that we've had where we work together, we agree the messaging, and then they go into the publication. I guess the other thing to say is that, as you can probably see, a lot of the imagery we are able to use from national assets, for example. So if there's national campaign materials, we don't really need to reinvent the wheel or spend a lot of money on design. We can just localize some of those assets, and then we can put those out. Other things we've had to kind of design ourselves for something particular that's going on in just Greenwich specifically. But a lot of the time, if you're short on budget, then it's really good to look at all the national campaigns and assets available and then just adapt them, so you don't have to go out and try and invent your own kind of materials, which can obviously be more expensive.
Thanks, Wendy. This is just to show another example of kind of how we've now aligned very much in our strategic framework as well. So previously we would have had separate plans and strategies with obviously some synergies and a bit of crossover, but we've actually now moved to being kind of totally aligned. So there are two documents that are statutory requirements of both of our organisations. One is the ICB 5-year plan, the Greenwich part of that, and one is the Greenwich Health and Wellbeing Strategy, which is an obligation of the council to produce. And actually what we've done is we completely aligned those, so they cover the same areas, they've got the same objectives. It is they're essentially the same, just just formatted differently, really, with a little some variations, but pretty much the same and very closely aligned. And that gives us the framework then to plan our partnership work on, and it helps us identify those shared objectives and shared goals. And
again, we worked on that together, didn't we, very much with our directors and the director of public health. But Russell and I sort of operationally were going through the sort of objectives and outcomes and looking at looking at what your shared goals and outcomes are, and then trying to not have 2 or 3 or 4 separate strategic documents all about very similar things but with slightly different outcomes. So we've tried to actually make sure that they're the same outcomes in both of those really key documents. So it makes it easier for people and for our staff underneath us to know, you know, if they're working on this objective, they're working on the ICB sort of objective for Greenwich as well. So it's worked quite well.
Great, thank you. So it's a Friday, and everyone, even those working in health and public health, loves a takeaway on a Friday. We thought we'd leave you with some takeaways. It's not easy. We know that, you know, the money that was available during the pandemic for us is not there at the moment. ICBs are facing 30% running cost reductions. Councils have got, you know, real financial need to make huge savings with things like the medium term financial strategies. But what I would say, and I'm sure Wendy would agree, that you know, although the money's not there, that makes it even more crucial that, you know, we work together and that we pool what resources we do have between us so that we can have the most impact for our residents, really. And, you know, one of the, you know, sorry, I'm spitting my words out a little bit. Put the effort into the relationships. It really is such a key thing, you know. Wendy and I have developed our relationship through working so closely together. And it's so important, and that is, you know, you still need to do that, especially if the people are changing. So I would say, you know, if you're in an ICB, have a conversation with your council. You know, identify who your key links are. You know, talk about what's changing, what's staying the same. You know, who do you need to work with on things like that. If you're in public health, link in with your existing connections in the ICB. Ask what's happening. You know, find out who the contacts will be going forward, and make sure you put some effort into developing those relationships. I think also identify your common goals. Make the most of what, you know, I've mentioned this already, but make the most of what you can together, work together where you can, and build your work around where those synergies are. Wendy?
Thanks, Russell. Yeah, as I've already mentioned and explained our partnership. So if you've had an old partnership in the COVID times, is that something that you could resurrect? Can you get people back together? If you've not had a comms sort of partnership before with a range of people, then have a think if that's something that you could actually replicate in your area and see how it goes and see the impact of that. Like I said as well, plan together, plan early. We're often very reactive in this field, and sometimes we just can't help that. But the earlier that we can plan together, have a forward plan, you know, all corporate comms teams have forward plans. You know, if you can work on those public health elements of those forward plans, get them on the plans, but then look at where else the NHS plans can be fitted into that forward plan and work together on that. You know, make sure you can sort of look and measure and demonstrate the value of working together. What's been the added value of coming together? What's worked well? Demonstrate that partnership and feedback to people on the outcomes. And in COVID again, we were able to really track that. You know, the data, be able to see the outcomes from things that we were putting on. And like Russell was saying about, we did a lot around, like, let's talk about the vaccine, walking around the streets, and like a lot of neighbourhood engagement work, and we could really see the numbers of people taking up vaccine through that. The other thing is we've used, you know, things like that you've all probably used it, like QR codes. So where we've had sort of leaflets or materials printed, then we can see how many people have actually just been able to click on that particular QR code to come through. So you can track that as well. And I think that, you know, identify and take advantage of opportunities. There is, you know, recently we've had announcements about increased tobacco funding into tobacco treatment, into OHID are getting more money around their campaigns. There's money into drugs and alcohol. There's the Accelerating Reform Fund work coming up. It's not just necessarily financial opportunities. It's looking at about what opportunities that you can grasp together, that where you've got shared goals, I guess. So for example, where there's a consultation, for example, at the moment there's a smoke-free generation consultation out. So we want to make sure that our you know, we've got in the local authority, we are very driven by our political agenda and our members and getting them involved. So how do we brief them on what's going on around a consultation? How do we get their support? But then what other health messages can we bring into that consultation? So we might publicise the consultation, but then also if you want help and support with tobacco treatment, where do you go? So adding that into any kind of messaging that's out there. So and again, another example of partnership working is around a lot of enforcement work that we've done around illegal tobacco. You know, you might have found a seizure of some illegal tobacco or alcohol. In the past, that might have just been publicised on its own, but I like now to maybe get a public health message alongside that. So yes, we've done this enforcement work, but if you're a smoker and want help with tobacco treatment, then you have the referral at the bottom of that article. So the main thing is about enforcement, but we don't miss that opportunity to also guide people and signpost people into treatment or what the appropriate NHS service is. So I'm always trying to think of what is the joined up message in this main article. It might be about that, but what other multiple messages can we get in, obviously without overloading it, but it's about that partnership and joined up thinking, I guess. So it's not just financial opportunities, it's just what's going on and how can you get in messages about public health within some of those wider policies or consultations or other things that are going on. So I think that's it from me. Thank you.
Thanks, Wendy. As Wendy mentioned, the Accelerating Reform Fund, JP, did you want to come in about something that CAN are doing that could possibly support that?
Absolutely, yeah. I will come back to that in just a moment. I just wanted to go through some of the data that you guys have been feeding back. Really interesting around the rating of the current ICB Council partnership. It's pretty good. The average rating was 3.5 from 25 responses. Most people were in the 3 to 4, which is a really good sign, and that's really positive. Hopefully today you've got taken away some things that you might be able to use to further improve those. In terms of the things that people find challenging, contact and budget came up, also localization, I assume, but other points around, yes, resources, terms, sign-off processes, starting relationships, all those things sort of popped up, but really it was regular contact, localization and budget that was key. And in terms of things that are working well, relationships came out as the top. So it seems like you guys are doing well in this front. In terms of things that stood out for me, I thought that from your point, so reminding ourselves of some of the good things we were doing during the pandemic, and using that as an inspiration for the ongoing relationships, which need to be based on, of course, shared goals and trust, and that where you have those things, you can then build much longer term plans, so much less frustrating late reactive stuff and more strategic. So that is the incentive, I think, for spending time on developing those relationships. And a key point that as things are changing so much, small amounts of time, finding out who the people are, finding where those networks are, is something that we need to be thinking about in the coming months. I think that keeping that regular and then starting to share resources. I think that the points you made, Wendy, about comms channels that the council owns. The council is the biggest media owner in its area. Its web, email, sometimes print publications, sometimes other things are incredibly powerful resources, and that the more you use that, the lower cost campaigns can be, and the more sustained they can be over longer periods. But yeah, councils are brilliant for that, and I think that's a huge area for opportunity. It also struck me something that communications people are not always that good at, which is I call comms. So whilst you're doing all of this, you need to think about the comms plan for telling everybody around you what's going on. And that reminded me of Tariq's question. He said, what involvement did senior leaders commission or to support these relationships happening in the first place? Did you just do it and then tell them, or did you involve them at the beginning and get permission? What would your tips be around that, and how do you communicate back to people outside communications about the wonderful work you're doing? Wendy, you smiled. I assume you have some tips and ideas.
Well, Russell, do you want to say about, I guess it's the legacy of COVID really, because we set up a partnership group. We had a public health consultant that was obviously leading on a lot of the COVID response locally, and so that was really where we then decided that we needed a specific comms group because there was just so much to do. So I guess it was that, and then like the group originally was kind of chaired by yourself, Russell, wasn't it, and our head of corporate comms in the local authority at the time. So I think that was the sort of senior buy-in. For me personally, my DPH is very aware of all this activity. We feed in to our lead member, our member that leads on health and wellbeing, but also within my public health sits within health and adults in Greenwich, and we have also a health and adults comms group now. So internally we are meeting across our actual directorate about everything that's going on, and our corporate comms team keep a actual record now, following me suggesting it. I said, because we do all these things and we don't necessarily keep a record of what we're doing, so how do we then tell people how active we've been? So now we are keeping like coverage of like everything that we put out, the kind of responses, the engagement, the click-throughs on social media and things like that. So everything we're doing, we're now actually keeping a track record of that, really. So then our corporate comms take that to their DMT, to the real senior directors, to tell them about what's going on from a public health and health perspective. So that's internally, we've got that kind of hierarchy and that governance where it's fed back into now. But I suppose that's quite it feels a bit more organised than it has been in the past, I guess, having those pathways back up.
Brilliant.
I don't know if there's stuff you want to add, Russell, from your organisation, and obviously Neil involved as well and regularly knows what's going on.
Yeah, I mean, I think I was probably quite lucky in that when I joined Greenwich, there was a lot of support for this. You know, I was encouraged to do it and to work much more closely with partners. And you know, the pandemic may have been the driver of that, but you know, there is a lot of support. Where sometimes where sometimes I'm a little bit conflicted is I'm part of South East London. I'm part of the South East London team, and I think sometimes there's competing priorities there with South East London stuff and actually Greenwich, and that to me is more difficult. And I'm sure Wendy has similar things, but yeah. Was there any other questions, JP?
Yes, there are a few questions about joint branding and the impact of that. Which I think is a very interesting one. We've had experience of delivering messages, for example, to young people with no branding at all, or very, very little branding. Do you see any negative impact of using the NHS and council brands? What do you generally try to do, and why do you try to do it that way?
If I can go first, Wendy, I think this is somewhere we've seen a big change, actually, probably driven by the pandemic. When I started, the council's default was we had the council logo on everything, and that's it, and we had some sensitive conversations around branding, but now I would say it's become much more the norm for a council and an NHS logo together. It has become much more normal and much more accepted. I think so. There's a question about kind of research into the impact of that. We haven't particularly specifically researched that. Be really interested to know if anybody else has, or if any other patches have done that. Wendy, did you want to add anything to that?
Yeah, I think it depends on the situation. Like we said, I think we've argued in the past that where public health moved into the local authority, and then for us we were leaving our NHS sort of roots behind. We were then having to sort of promote public health services with a local authority logo, and we weren't really sure how that was landing with the public, because obviously we feel that the NHS is a very trusted logo and a trusted brand. So I think there are benefits of working in partnership where we can say the vaccination programme, for example, had NHS all over it, but also the partnership showing that the local authority was there and involved and supporting. So in that way it shows strength. I think you certainly can have death by logo. We were very clear that we didn't want loads of logos all the time all over something. It's totally confusing, messy. I think we're still trying to sort out about the partnership logos around the ICB, you know, the Healthy Greenwich, when to use what logo, and I think that kind of is still to be worked up in terms of the public identifying with which one and not confusing people. But I think also targeted work, we need to be aware that sometimes, you know, logos can put people off as well, and I think people, like you said, examples of working with young people in particular, and you know, some work we're doing around breast screening, for example, you know, where we've had higher level, you know, or other campaigns. Russell, you talked this morning, didn't you, about the mental health campaign, and you know, certain websites that people then land on, then they just bounce back straight out again and they don't carry on clicking through. So I think about it's looking about what works and doesn't work around different audiences and different topic areas, and where people feel comfortable and safe to stay. And so sometimes microsites might be the answer because it doesn't get branded at all, and then people would just see it as that information. So I think learning, and this whole community here, is, you know, what works somewhere might not work somewhere else, but it's always good to sort of share that good practice and learning. Yeah, I
think that's a very good way of putting it. We've seen different results in different applications, so be sensitive and think about, and maybe, you know, consult with the audience and find out from them. Seen a brilliant example of this community already sharing things. People were talking about targeting the traveller community. Helen, Ashley, thank you so much for sharing that information. There are other good examples that we've seen in other places that that we can share here as well. Maybe we'll set up some sort of sharing function that we can go. I can see as well. Someone was talking about using the Future NHS website, another good resource for data and things like that. I think Simon Yates, Wendy, if you could get in touch with Simon afterwards around what's happening around the smoke-free consultation, I think that might be a very good future topic. We'll get to future topics in just one moment. In terms of working with finding things to work together on, Russell, you kindly mentioned the future funding, £42 million worth of funding for alternative care provision. It will be sort of an adult social care, public health combined activity. We're running 2 workshops next week and the week after around applying for that funding and some potential applications for testing that funding. So if that's something that you want to work together with your partners on, feel free to attend these free events next week and see where we're going from there. Yes, we will be sharing slides, and we'll be showing maybe some edited highlights of today. Don't want to reveal anything that people might find sensitive. Yes, I'm just also going to put live this other poll. I'm conscious of the time. We'd just like to get a bit of feedback from you about which of these messages, which of these topic areas would be useful to you. So if you could just quickly go through and tick the ones that you would find most interesting. Russell is going to shape this community around your priorities, and we'd like to be able to give you things ahead of time. For example, Wendy sharing some of the approaches to the smoke-free consultation and some of her experience over the past 20 years in running smoking cessation or maybe nicotine cessation campaigns, and maybe slightly wider addiction. But if you could please tick those topics, and that will help us shape what we do next. I'm very conscious that you know, we're now at the end of time, so I understand if people have to leave. But I'm just going to quickly go through some more of the questions here. Thank you again for taking part and for being so active in this. And we're going to create more spaces for you to for you to answer. So if I scroll up here, apologies. Are there any that you can see, Russell or Wendy, that you want to jump on?
In the earlier questions,
yeah. Russell, you talked about trust. What was your first meeting like?
So I guess I'm trying to remember back to the first meeting where we all came together as a partnership. I would say there was a bit of nervousness and possibly even a little bit of paranoia there from some people. It was people were nervous about moving outside of their comfort zones, I would say. Would you agree with that, Wendy? Yeah.
I mean, I think if you think back to the pandemic as well. It was really firefighting. It was really, you know, everyone, you know, we were all quite scared. You know, I think everyone personally was scared about their own health and well-being and their family. And then it was just like, you know, how are we going to do this? And but I think overall everyone just knew we had to put everything aside and just focus on the tasks and actually just, you know, work together. So I think, you know, in the pandemic, it was very clear what we, you know, that we needed to work together. We couldn't work on our own. I think the first partnership meeting, I think it was, you know, trying to encourage and support and motivate people to say that this was still worthwhile to carry on and look at what we achieved, and just reminding people and reflecting and saying, you know, this really worked with COVID and we really appreciate, you know, you're really busy people, but I think this could work by carrying on and trying to keep the momentum going post pandemic around other health topics. And we've certainly done that with so many other subgroups around different topics. So yeah, I think it's just keeping it fresh and meaningful for people, and they can see the benefit of, like this group, you know, what's the benefit of being part of a community? What do you get out of it? Everyone's really busy, so it's actually got to be for benefit for people and seeing what they get out and sharing stuff and not reinventing the wheel and learning from each other, really. So I think that's the same in most partnerships.
Yeah. And please, I think there's a lot of interest around press releases and smoking related press releases now. So if it's all right, we can just use the chat for this meeting to share what we're doing, share what's being public. I think West Sussex have shared something just now, which is wonderful. You know, we don't need to start from scratch or reinvent the wheel. That's very much the ethos of this group, and borrowing ideas and helping each other is exactly the point of it.
I know people need to go, JP, but just to flag, I mean, people that are from the tobacco world like me will be very aware, but ASH, Action and Smoking in Health, a fantastic organisation. On their website, they have got brilliant resources. They have produced briefings for a range of people. They've produced briefings for your counsellors. They've produced template letters. They've produced template responses that they are recommending for people to respond to the consultation. So they've got loads of resources on their website, and so you can pick those up and just localise them. So I'll just recommend looking on the ASH website. I can post it in the chat afterwards, but I don't want to get distracted, and
that's
I
all right.
just want to focus on that. But I can put that in after. But there's certainly, I mean, people will be familiar with ASH, but they're a great resource for being able to pick things up. So yeah.
Fabulous. I've also put, we get a lot of requests about vaping as well, and how to tackle that side of things.
Yeah.
Yeah, Michelle Crowley. Oh, that's great. So yes, different services all commenting at the same time. That point about layering up that you talked about, Wendy, you know, when you're saying one thing, you can also say another. I think there's also something about multiple services coordinating communication so that people hear things from lots of different angles. With public health, hearing the same thing lots of times from one source is not as effective as the sort of social norming effect of hearing things from multiple angles. Is there anything else that people would like to add? Numbers of admissions in hospitals. Okay, yeah. So getting the data in the first place on what is the problem, who is it, a huge challenge. Hence one of the topics being around quick insight and data tools, ways of coming up with data that might be something we'd like to look at later. Yes, so I think if that's it would be a great time to say, you know, thank you so much, Wendy, for joining us, and for Russell for talking about your initially forced but now fruitful and organic and totally natural relationship. I'm sure that's, you know, similar to many people. It was really reassuring as well to see earlier in the comments, you know, how people are creating different forms of the kind of ideas that you've got already there. Also, there's a positive message that actually the relationships are good overall. Room for improvement, but we're in a good place, and I think it's just about doing more of that and working together more clearly. We're going to come back to this group with yes, Michelle, we intend to do more events. So if you could fill in the things that you're interested in, and we want to do events quite regularly, maybe once a month, maybe more frequently, on topics that are pertinent, and critically as well, giving you time before something needs to be done to share insight, share good creatives, share lots of learnings, so that you then have time to implement where you are. We want to be ahead of the curve, giving you things that you can use and then make your lives easier. Russell, is there anything you'd like to add? Oh, sorry, mate, you're on mute.
Sorry, I muted myself because I was coughing. Yeah, just to thank everyone for coming, and I think it is really reassuring, like JP said, to see that the relationships are quite in a better place actually than I probably thought they would be from this. But what's key is trying to make sure that those are maintained, because lots of the people are going to change in the next few months, particularly in the NHS. Your contacts are going to change, so those of you working in local authorities, make sure it doesn't slip back, and make sure that you get to know your new people and build those relationships there.
Fabulous. We've got a little bit over, but it seems that it's been a useful thing to do. So thank you, Russell, for starting to put this community together. I hope everyone has relaxing weekends, and we look forward to seeing you all again very, very soon. Thank you so much.